New to ET Talks, let me just welcome you again as well, and know that you always have an opportunity to submit questions in advance. So we will post always about these ET Talks, usually at least 2 to 3 weeks in advance, sometimes a month in advance. And on that form, when you sign up, you have an opportunity to post a question, but we also encourage you to join us live on Zoom, type your questions in the chat, or if you're more comfortable in our Facebook group, we always try to stream in there, and we are streaming today. So you can put your questions in there as well. So we like for this to be a family atmosphere. And those of you that have been on our ET Talks before, you know that. We are a very closely knit community of 10,000, but we are a very closely knit community. So we will go ahead and start. We had 2 pages worth of questions, a lot of questions came in for this ET Talks, which is wonderful. So we'll go ahead and start with those. And again, you're going to hear, I am a neurosurgeon and a neuroscientist, so I will probably be the one to start answering the technical medical questions and that sort of thing. However, our entire panel here, Diann, Randy, Stephen, all of us here have something important to add to these discussions, and particularly the life impact discussions, because there were a number of those that came in through the questions. So you're going to be hearing from all of us today. So let's see, what should we start with? Well, I think we're going to start with a basic question. So somebody asked, they said that they have essential tremor in one hand, their sister had essential tremor in a different hand, and then they have 5 children, but only 2 of them had essential tremor. And so the question was about, why are there differences in the type of essential tremor? Why did only 2 of 5 children get essential tremor? And I think that's a good place to start, because these are some really common questions. So first of all, essential tremor, which most of you know, I know a few of you are new and might be caregivers, but it is different from some of the other movement disorders you may have heard of. And generally, essential tremor's main feature, not only feature, but main feature, is a tremor called an intention or an action tremor. So when you're trying to write, when you're trying to eat and drink, trying to do buttons, that is when the tremor comes out. And it is not as predominant in early stages when you're sitting, for example, with your hands folded in your lap. So it gets missed a lot. It gets misdiagnosed a lot for those reasons. Also, it tends to start on one side of the body or the other. Now, I'm fellowship trained in movement disorders, and I've been doing this for, almost 20 years now since my fellowship. And I will tell you, I have not seen a pattern as far as in families, it's always on the same side, for example. And it's not even, well, my dominant hand is the one that develops tremor first. Sometimes it's the non-dominant hand that develops tremor first. So there's no rhyme or reason to it that we have been able to identify to this point. Now, there is a genetic component to essential tremor. So it's called an autosomal dominant transmission, which means 50% inheritance pattern. Okay, so if you look at raw numbers, if someone with essential tremor were to have 2 children, one child might get it and the other one likely would not. Obviously, those are ratios and averages. So some families, you can see it in everyone down the line, right? And in other families, you don't see it so much. But hopefully that answers some of your questions about that as well. And I'd love to hear from, Diana, do you want to share a little bit about family line with essential tremor from a personal standpoint?
Sure. For me, I'm not, I don't have the background for the family to find out who had essential tremor. That's a whole nother discussion, but because I was an orphan at 3. But my son, I had 2 children. I have 2 children that one child developed essential tremor. The other one has not yet. Now, that is the other thing, Darlene, that it's like you never know what age. So to answer the question, in my opinion, is the children in the family, they may develop essential tremor, but they may be 50 or 60 years old when the tremor shows up. That is another question we all want to know. When? Why is it some people at birth, some people children, some people, in their 20s like me, or 50s, 60s? So that is kind of the thing. You don't know if your siblings are going to get essential tremor because until they're older. And if you have a big family, it's kind of a wait and see, which isn't a good thing to say. But that is my answer.
Yeah, absolutely. Absolutely. And one thing that has been noticed sometimes is that if someone has essential tremor, typically, not always, but typically their child will get it at an earlier age than it showed up in them, but it's not always the case. But it
Right.
is common. So let's say one person got it at 60, their child might get it when their child turns 50, right?
Right.
So yeah. So does anyone else want to talk about your experience with that in family, or if you have any other questions, those of you that are on here now, do you guys have questions about family inheritance with essential tremor, or share your experience?
Oh, all
Okay.
right.
All right. Well, that's okay. If you come up with those questions, you can ask them later. And then Diann, do you or Randy, could you keep an eye on the Facebook group to see if there's questions coming in? Because I want to be sure to add these folks coming in as panelists. So again, if you're just joining on the Zoom, you have an option to come up as a panelist. That doesn't mean you have to talk. It's just so
Right.
we can connect and see each other's faces, and it's a nice community way to do things. Okay. All
Right.
right. Let's see. So there were some questions there's a lot of questions about research, but I think I'll get to those later because those are a little bit more involved. So there was a question about stopping head tremors, which I think is a good question. So not everybody with essential tremor gets head tremors, but a lot of folks do, or may have a voice tremor. And it's something we definitely see more with more advanced. So ET can be progressive, and it is progressive in a lot of people. The rate of progression, highly variable, right? Like some people will progress very rapidly, other people will progress very slowly. All right. So, but those that have had it for a long time, we see more of the head tremors. That doesn't mean you can't have head tremors from the get-go. And the medications that are currently available, not the ones in clinical trials, because we don't have all the data on those yet, but the ones currently available tend to impact mostly hand tremor, from what I've seen. And then if you do move forward with a procedure such as deep brain stimulation, which is one of the procedures I do, I'll share a little bit more about later, because there was a question about that as well. We can only see control of head tremor when we have leads on both sides of the brain. So if we put a lead in on the right side of the brain to control left-sided tremor, then we're not going to see a stop in the head tremor. But if they did need both sides done, then the head tremor would generally improve once both leads are in the brain. And we don't have enough data from focused ultrasound yet, because that has only been approved for both sides and not done at the same time, but sequentially since 2020. Okay, so we don't have enough data from focused ultrasound to know if that is going to manage head tremor really well. But that I thought was a good question. Does anybody that experiences or has experienced head tremors want to share anything about that or ask more questions? Diann?
I have had tremors. Do you, Lynn?
I have head tremors. I have a good friend who does. And in fact, she's in my support group and she's always asked if there's anything for head tremors. And up till now, all I'd heard about is Botox. This is the first I'm hearing that DBS on both sides could help head tremors.
Yep, absolutely.
First I've heard of it.
Yeah. Yep. We saw a great benefit, and I've done, I don't even know how many, probably 500 surgeries, and not everyone obviously has head tremor, but those that did, that we were able to place bilateral, did very well with that. So, okay, great.
Thank you.
Yeah, that's same as me. I have head tremors, and they do get old. I have to say that, because when you're trying to, if you're holding something and you're trying to read something with your hand and your head's tremoring at the same time, it's not a fun thing to do. So that's an interesting, that's good information. So.
Mm-hmm.
Stephen, did you want to add something?
Well, I definitely have severe head tremors. I was diagnosed after 20 some years of diagnosis with essential tremors, diagnosed with cervical dystonia. And I have been doing Botox treatments for about a year and a half now. And I've gotten a great deal of benefit out of that. It has helped control the head tremors. The issue is at some point, I'm sure my neurologist and I will be discussing how long the Botox treatments will be effective. But I was fortunate enough to, she also recommended acupuncture. And I have been doing acupuncture again. I had done acupuncture before, but I've been doing it since August of 2023. I go monthly and I do e-stim and regular acupuncture. And I think that is even more beneficial in helping with my head tremors. And I think because of my head tremors, I've developed lower back pain. So now I'm getting treated for lower back pain as well. So because I'm always trying to control my head tremors, it definitely has impacted my lower back. So, but Botox treatments have been very effective. I've been pleased. I wasn't sure if they would be. I found it kind of odd that it would work, but it has definitely helped.
That's excellent. Yes, that's a wonderful treatment. Thank you both for bringing that up. And yeah, acupuncture, I love this as a therapy. We at Diann Shaddox Foundation, we are always emphasizing holistic treatments of essential tremor. There's so much available naturally, right? Or even with Eastern medicine that is less invasive than taking medications that have side effects, right? Or deep brain stimulation or focused ultrasounds that can have some long-term impact. So certainly we highly recommend that you talk to your physicians and healthcare providers in general about some of these other therapies. Acupuncture is great. And even Stephen, so I understand getting back pain as a result of that. And I'll tell you in advance, there's probably some neurosurgeons that would MRI your back and say, hey, you need surgery. But I would tell you, maybe consider going to a chiropractor even. So I know Stephen, so I'm not giving medical advice, but I happen to know him. But that might be something that would be a good option to do if everything else looks good, as opposed to having someone cut on you. So it's just a choice. Okay. Diann, are there any questions in the Facebook group? We still have quite a few, but I want to honor those as they come in. All right. Well, just let me know.
Okay.
The next question was about suggestions to slow the progression of essential tremor, which I think is a great question that I don't have a great answer for. Okay. So the treatments, including the medications, surgical treatments, and even holistic treatments, I would say, are very targeted at treating the symptoms and not the root of essential tremor. The research about the root cause of essential tremor is just now really coming to the forefront, whereas for other movement disorders like Parkinson's disease, where we can say, okay, it's a problem in the substantia nigra, dopamine, this is the problem. With essential tremor, for a long time, we haven't had a definitive answer. And I would say we still don't have a definitive answer. We do know that there's some connections between the cerebellum, which is the back of the brain that controls generally balance, and the thalamus, which is where we would put either a deep brain stimulator, right, or do a focused ultrasound treatment. So we're starting to learn more about that. But as of now, there's no definitive treatment that says it will slow the progression of essential tremor. But again, let me reemphasize that everyone's condition is going to progress at a different rate. All right. And we don't have good predictors of what that might look like. So for one person, if they're diagnosed with ET at age 50, it might look very similar at age 60. And for someone else, by the time they're 55, it might look really progressed. Okay. So I do want to emphasize that. However, a lot of particularly the holistic treatments, we've had folks come on and talk about nutrition and different exercise treatments, right? And those really mitigate or lessen the tremor and improve quality of life. Because that's, to me, that's what it's all about, right? If we can get your quality of life improved, that's infinitely better than me having a patient at the, at my office, and I'm saying, well, your tremors moved down from a 4+ tremor to a 3+ tremor. And they say, well, you know what? I'm still triple typing, my T's on my keyboard. So that really doesn't help me very much, right? So it really is, it's about quality of life. And I would say the more interventions that you try and work for you, like just diet alone isn't probably going to do a whole lot, right? Just a medication is probably not going to do a whole lot. Just doing Tai Chi, for example, is probably not going to do a whole lot. But when you find those things, diet-wise, movement-wise, possibly medication or device-wise, that can help you, that combination, I've seen major transformation in a lot of folks. And I would also say, don't forget the mindset piece as well, because it's very key what your attitude is, I would say, towards essential tremor. You've seen hopefully a number of the ET stories that we've posted so far this month. We've got probably half a dozen more that will be coming out over the next couple of weeks as well. And one common thread that I think you'll see from the folks that we're talking is, look, they've had significant hurdles to overcome, right? But they don't let ET be the focus of their lives. And they have determined to move beyond it. And so having a goal, I call it a goal beyond the goal, right? Let's not just stop the tremor, but what do you want to do once the tremor is stopped? I always ask my patients that, right? What do you want to do beyond that? So that mindset piece is really, really key. And I believe the body's created to help heal itself. Okay. Obviously, we have things to help the body, help it do that. But I do believe that there will be a different answer to your question about how do we slow progression of ET in the coming years. So I wanted to share that. So Lynn, you have your hand up. Go ahead, please.
Yeah, I do. People I know who've had DBS surgery and even the focused ultrasound have told me that their condition does still progress. Is it maybe less because they've had these procedures?
The clinical studies have not suggested that to date. However, those procedures tend to be very dramatic. So DBS, for example, the day we turn on that DBS, I mean, we turn it on in the operating room and then we turn it on for good about a month later. I mean, it's such a marked difference, right? And I do have patients that'll come back maybe 10 years after having had DBS, right? And they'll say, I don't think it's working anymore. All right. They say this to me, the battery's fine, the leads, we checked them, everything's fine, right? And they say, yeah, but my tremor's like this again, so I don't think it's working. And I said, well, let's turn it off. Let's turn it off and see what happens. And you can see how the tremor has significantly progressed. So it's possible. I mean, DBS we've been doing since 1987 for essential tremor. So, but that was very sporadic. I mean, it really hasn't been used as a significant therapy, I would say, until the late 1990s, and then really mostly in this century here. So I think we're going to, and it's been refined a lot more. I'll say this too. So some of the newer systems that are being studied, not available yet, but studied, will actually, it's very personalized deep brain stimulation, for example. So there's a sensor that'll measure the electrical chemical changes going on in the brain and will only deliver the pulse when it's needed. I think some of those, when those come to market, I think we might start seeing a slowing of progression of a lot of different movement disorders, in fact. So hopefully those will be coming out soon.
All right.
Thank you.
Did you see Stacy?
Stacy has a question in the chat.
Yeah.
Okay. All right. So Stacy, thank you for being here. You said your question is, since ET is exacerbated by anxiety, why doesn't anxiety medication help with head tremors? Okay, good question. So anxiety medication is designed to help with anxiety. I have my own thoughts on that I'm not going to discuss here because it's not the place or the time. But as with many of the currently approved treatments for essential tremor, none of them is designed to treat essential tremor. They are medications for other purposes, okay?
Right.
They're for blood pressure problems. They are for seizures. They are for nervous system, general, you know, let's just throw something that works on the nervous system in there and see if it controls tremor. Somebody asked about gabapentin. Well, guess what? You know, I mean, gabapentin is a prime example for that. We give gabapentin. There's a list. If you go look up gabapentin, there's a list of about like 30 different indications for gabapentin, right? Okay. ET is one of them. It's not the primary treatment, but it doesn't surprise me at all that anti-anxiety medications aren't going to improve head tremor, but they can in certain instances. And all these kind of meds for anxiety, depression, most psychiatric diagnoses are designed to be used for short periods of time. Okay. They are not supposed to be a lifestyle treatment. All right. If you are on, and I feel comfortable saying this to almost everyone. Okay. If you have been on an antidepressant for 30 years in your life, you should probably talk to your doctor about that, because they are designed to help you get through short periods of depressive episodes. Okay. They are not supposed to be a lifestyle, and anxiety meds are very much the same way. And I will get off that soapbox now. Sorry. I think it's important. I think that's important. So the medications for anxiety can help to lower your overall anxiety. To that degree, if you're less anxious, you may tremor less, but the root cause of the tremor is still there, right? The root cause of the tremor is still there. So it's one of the reasons, like propranolol, right, in addition to being a blood pressure medicine, is also given for people that, you know, they're performers, that before they go speak on stage, a lot of politicians take propranolol, right? Because it lowers your heart rate. It keeps that response of anxiety from coming. So it can help that as well. But none of these meds right now that's currently approved, that's not in a clinical trial, is designed to address tremor. So hopefully that answers the question. Okay. All right. Let's see, what else do we have here? We dealt with that. So a lot of, okay, one other kind of general question about essential tremor, and this I'm going to give to the panel. So this person asked, they have essential tremor, but they kind of feel like they have tremors everywhere. and like some that don't even show up on the outside, but are kind of inside. So I'm going to give that to the panel to talk about.
Okie dokie. All right, I have internal tremors. That is something that was really weird when it began because it is, you like, if you're laying down in bed, you feel that little bit of vibration. And you're like, am I shaking? And you look at your body, and your body may not be shaking like you're doing your hand shaking. It is a vibration. Now, other people have other descriptions. So yes, this is something that I have been really agitated about, because in the beginning, when I started getting out there with the foundation, I was told there's not internal tremors, there's not this tremor, there's not that tremor. Well, now we're hearing all these tremors are a part of it. This is what we're trying to do, is find out why and what is happening with our bodies. It comes from the brain, like Dr. Darlene said, but people don't realize all the different tremors. We're going to get that out there. I can't answer the question of why we have all the different tremors, but if you start to tremor anywhere on your body, please go to a neurologist or movement disorder doctor and talk to them. And, because there are, like we talked about, head, voice, I have the voice, legs, internal, of course, the hands and the whole body. So please go talk to your doctor, because these are parts of essential tremor.
Absolutely. Thank you, Diann. Does anyone else experience that kind of tremors that you feel all over but don't really manifest on the outside? Does anybody else experience that who's here? Yeah, I see some heads nodding.
I also have internal tremors. They're very much exacerbated by stress.
Okay.
So I forget I have them for a while, and then when I'm presenting or something, all of a sudden it's very evident to me. So it's just interesting how that manifests.
Okay. Yeah. Thanks for sharing that. Have you tried any medications that have been helpful for you with that? Have you maybe tried like a propranolol or something like that when you present?
No, I've been encouraged to do that, but I have not yet. I actually haven't tried any medications. I've just been managing with yoga at this point.
Oh, nice. Okay. Well, I'd love it if do you feel comfortable sharing a little bit about your experience with yoga? I know a lot of people might want to hear about that because that's one of the great natural therapies for ET.
Sure. I like to hike, and I notice when I hike, sometimes my legs just go out unexpectedly, and that was a big issue for me. So I looked into yoga, and nothing too advanced, but even the simple moves, doing them on a regular basis has really helped. Even when I'm, say, waiting for my groceries for my my daily order, I stand on one leg and do some of the simple moves. People watching me probably question what I'm doing, but that's okay. But again, doing it on a regular basis has really helped when I'm hiking, not feeling so unbalanced.
Awesome. Thank you for sharing. I love that. Even doing it in line at the grocery store. That's awesome. Some simple movements. So great. Very good. Well, it's also an opportunity if somebody does ask you, right? What are you doing? Why are you doing it? It's so important, right, that we talk about essential tremor. It's so important that people begin to not be afraid of it and think it's something that it's not, right? There's so much misinterpretation of essential tremor symptoms by a lot of people in the public. So that's a great opportunity to be able to share about that as well. Thank you. All right. There were a couple of questions about, I'm trying to group everything together. Oh, this is a good question. What do you do when essential tremor affects your job? All right, so this person is actually a radiographer, they said, and so they were taking x-rays and that sort of thing. And so I could imagine the tremor gets in the way of that, especially hitting that button to, start the x-ray and that sort of thing as well. And it's true, a lot of people struggle on their job, but I'm going to defer that. I wish Dr. Drew were here. I know he's got a story along those lines, but would anyone else who's on the panelists like to talk about how essential tremor either has affected your job in the past or how it might be affecting your job? Would you guys like to share about that? And if not, I will tell you the video we posted yesterday, she talked about her job and essential tremor. I encourage you to listen to that testimony. It's so short, it's like 15, 20-minute testimony that she gave. And it is powerful because at one point her boss was like, what's going on, right? What are you doing? And the foundation here, Diann has worked very hard to both help people that have such severe tremor that can get on disability and even some options for that, right? You can talk about that. And then, in general, the awareness that we were just talking about. So people know, look, I'm not hungover and having shakes from that, right? Like I'm not on drugs. I have a medical condition, right? And to be able to have people recognize that, because there should not be discrimination in the workplace, period, the end, right? That's not okay. This is a medical condition and it shouldn't happen, but it does happen. Now, to answer your question specifically about what do you do, okay, I think education is the first point, right? Have a conversation with your boss about, look, this is a medical diagnosis. Here's what happens with it. That's the first place, right? So people are aware that you're working with. If they're not understanding that, then, there's a lot of other things we can talk about. And I encourage you to get in the group and get some information about ideas for that. But then there are some devices that we'll talk about in a minute, because there's a number of those questions that came out that are, wearables that can help with tremor in certain situations. If you use a keyboard a lot at work, there are certain keyboards designed for individuals with essential tremor. And like literally, if you hit a key 3 times in a row or something, it'll correct back to just the single letter. So like there's a lot of software programs available. So there's different things that you can do for your job. But the most important thing I would say is have that conversation with your employers and your fellow employees so that they understand. But Diann, do you want to talk a little bit about the work that we're trying to do with disability and
Yes. And I think see if Cher's on here. See if we can get.
Yeah, I just got her on. She might have been on, and
Right.
there's a long list here. So.
If Cher could be on. We do have programs, and that you need to go to our website, DiannShaddoxFoundation.org. We have many programs, and one is our Family Assistance Program, and it's also for individuals. And that does help people with disabilities, intervention, and with jobs. We will work with you as much as we can to help you in your job situation, handle a situation like we were talking about. You're not out there alone. We are here to help, and it's okay to tell your boss and everyone that you have tremors. It's really a difficult situation for people, and I understand, because I just in normal life it's enough, but having to discuss that. So please go and look and see about our family assistance program. If you're having problems at work and you need help, we will assist you in whatever we can do. So that's on the website.
Okay, excellent. Cher, thank you for joining us too, one of our board members. Cher, did you have anything you wanted to add to talking about how we deal with disability and the work that we're doing to help folks manage?
Sure. We're looking more into how we're working with somebody from a company that works with individuals to get a disability to find out how we can get essential tremor pushed through as a qualifying disease for being able to get like SSI. Because quite frankly, when we talk to them, I ask them, how many cases have you put through for essential tremor? Strictly. And they said none. So there's a big gap there. And we're just starting on the adventure too, of trying to figure out how to get this recognized as a true disability that causes people not to be able to function. And so that's a journey Diann and I and a couple of other people are going to be going down. It's not going to be something that's going to happen because in order to get on a lot of this stuff, you have to go through government agencies. And we know how fun that is. But we also, with the family assistance program, we have helped people look at different solutions to a problem. We do not have the money to be able to just say, okay, here's your rent for a month, here's whatever, okay? But we've been able to help them think outside the box and help them find resources in their area. Because let's face it, when you are wrapped up in trying to deal with essential tremor, it can take your focus off anything else. And it's very hard to think outside the box because it puts you in a state of anxiety. Absolutely. And everybody gets it. I don't care if you think you have it or not. But the two of them are brother and sister.
Right.
And it makes it difficult to concentrate and try to think of other things and you feel lost. That's why we're here to try to help you. To try to find a creative solution that's available to you. That's the big key. Because a lot of the people we have interacted are in more rural settings and do not have access to resources that people that live in a more metropolitan area do. So it takes some creativity, and we will ask you when you apply for what have you tried? Are you on Social Security? Are you on Medicaid? Have you been diagnosed with essential tremor? A number of things. And the thing is, it's very important. If you think you have essential tremor, but you've never been diagnosed, find a movement disorder specialist or a neurologist who knows about ET. Because the first step we are finding out to apply for any of these things is you must have an essential tremor diagnosis.
That's it.
Yeah, Cher,
Mhm.
so important.
And
Go ahead.
And we do have on the website, it's under, I'm not quite sure if it's under treatment, ET or treatment. If you scroll down, it does have the list of movement disorder doctors on the website. You have to just click on it, put your address and where you live, you've got to get the information and that's it. And it can tell you doctors in your area. So I know, that's what we're working on. There's not enough of you guys like Darlene. We've got to get more Darlenes out there, Dr. Darlene.
Yeah, yeah.
We have to get more doctors because like Cher said, there's a lot of areas where there's not a doctor to talk to. Now, what we're working on is trying to educate, inform, just your regular doctor. We want to get the information out there so that all doctors understand essential tremor. And please just keep joining us, helping us to work with this. But we are here to help. So if you have a problem, we'll work with you on we call it family assistance. Okay, I keep saying this. You don't have to be a family
No,
if you're an individual that needs assistance. So please
but there
go.
are families, Diane. They're
We
part
have
of the
families.
DSF family.
Yes. So anybody who needs assistance, we have all the programs, and we have the ET bullying, we have the suicide awareness, we have our educational initiative to work with children in the school systems. You know, we have our medical research we're working on, and as Cher said, I'm going to talk about this in a minute. But we need donations, we need help, because all of these programs need to be funded to help everybody. And we're out there. We are out there to work with you guys. Another thing I'm going to say before I forget it, is we have our patient council. We are still accepting people to join our patient council. If you have essential tremor and you want to be a part of making a difference in the world of essential tremor, all you have to do is just join it. We have Zoom talks like this, and they are private, very private, to discuss essential tremor and what we can do to make a difference in the world of essential tremor. So please look that up, DSF Patient Council. Okay, I'll give it back to you guys.
One last thing, Diane, about the patient council.
Yes.
Tell us if you are using any tool that may have helped you. Now, Diane can tell you, I am somewhat of a guinea pig. And I have been trying out a couple of things just starting in the last couple of weeks. And we will tell you about this stuff, what we found.
Yes.
That is the other thing. Cher is being, like she said, the guinea pig on the devices everybody's talking about, that are out there. And Cher, yes, she is a trustee and the director of the Family Assistance Program. She also has essential tremor. So she is trying out the devices, and we're going to see how they work for her. And if anybody would like to be a part of the patient council and help us on that, we would appreciate it if they want to try one of the devices and see if it works for them. That's how all this is going to grow. We can't do this alone. So, okay.
Absolutely.
No, and the other thing is too.
Cher, we're going to have to get on to a couple other questions.
Okay.
Because I really want to address, there were a number of questions about research trials. But I do want to, some of those questions were about devices. So if you had a question about the devices, a couple of them that are out there that are more popular these days are the Willem ball and the Calitrio. There's very preliminary research about those, but do connect with Share, do connect with our patient council, and you can get more information about those, okay? So there were a number of questions about what clinical research is being done right now and which companies are involved in those. Now, we do have some partnerships with some of these companies, and you are going to be hearing from some of them very soon because they will be featured in our ET Talks coming up. And I believe we have one coming up. Is it next month, Diann? Praxis, yeah. So Praxis has a phase 3 clinical trial right now for a new medication. Sage Therapeutics also has a clinical trial going on. Jazz Pharmaceuticals also has clinical trials going on. And these medications are much more targeted to essential tremor specifically, as opposed to, I mean, that's what they're developing, is a medication for essential tremor rather than, hey, can we, you know, pirate off of something else, right? And see if it works in essential tremor. So I am personally very, very excited about these. We've seen great results even with some of the phase 2 clinical trials, and you will find out that there are these studies, some of them are still recruiting. Some of them are still recruiting. There was another question about an individual who had complex regional pain syndrome, was worried that they may not be a good fit for the clinical trial. Listen, there's certain things that will exclude you from the medications. Like if you've had DBS, you can't participate in the medication trials. If you've had focused ultrasound, you can't participate in the trials. But there's a lot of liberty about what other medical diagnoses you may have, as long as you're not on certain medications during the period of the study. So I really encourage you all. We're going to be posting probably in the next few weeks. We're kind of taking information from a lot of these clinical trials that are out there, and there's going to be a little online quiz, if you will, where you can go in and see if you're a good fit and if there's a trial in your area in the United States mainly, but we'll try to add in worldwide as we can. And so that will be good, but don't assume, I think this is really important, don't assume you would be excluded. Okay, it makes sense to go ahead and reach out. Most of these have forms on their website that you can fill out if you're interested in being a patient in the clinical trial. So I encourage you to do that. So Diann, did you want to say something about?
Just Praxis. They're an in-home study.
Yes.
That is something that is totally different. So check them out.
Yeah.
It's not you've got to drive somewhere or do anything. So please check out Praxis. We have that on a worldwide group, and we have it on the Facebook page, and you can message us. So
yeah.
It's a very important one. I think it's the phase 3.
Mm-hmm. Yes.
Please, they need some more people.
They do.
Now, this is coming to an end, but please join.
Yeah. Yeah. I think that's such an important point that you brought up, Diann. You know, a lot of clinical trials, you have to be in a certain city and you have to show up for 10 or 20 different office visits or blood draws and this sort of thing. And Praxis, you can be anywhere you want, right? And they do everything online. They have it all streamlined, which is amazing. We were very excited when we talked to them about that. So you'll get to hear more about that. Join us next month to hear more about that. Lynn, did you have a question or a comment to add to that?
I did. I'm going to sound like Debbie Downer. I don't mean to. I apologize.
Yeah, that's great.
I have signed up for every single trial, medication, Calitrio, Vilium, you name it. I have epilepsy. And I have been, I will not be accepted for anything. So I don't know if anyone's heard of that. I know there's a lot of brain related issues. I understand. They're probably, I don't know if it's legality, they're not allowed to take somebody in case it affects the seizures. But it's been very disappointing.
Yeah. Oh gosh, I can imagine how disappointing that is for you. I'm so sorry.
Yeah,
I think it's a
yeah.
safety issue. They're worried about worsening seizures, and
Sure.
obviously that, that can't be part of a clinical trial. That's something that
Yeah,
have to be
yeah,
studied once those medications are
right,
approved, and then study it in a subset of patients with, and as you know,
right,
I mean, there's generalized epilepsy, there's complex partial seizures, there's
right,
that have
right.
seizures once a month,
I
and those that
know.
have 15 a day. And so it's going to be probably an individual decision between you and your
Yeah,
doctor. But I'm sorry that's been frustrating for you, but I do want you to know that's probably a safety
thank
issue.
you.
Just, they
Oh,
don't
I get it. And I
have it.
get it with the medications. To be honest with you, I'm a little gun shy myself,
Yeah.
but Helen Trio,
Yeah,
how is
I
that
know.
gonna give me a seizure, right?
Well,
Anyway,
it changes the vibrational frequency, and
right.
obviously that is one of the main problems with essential tremor and with epilepsy. So,
Yeah.
so yeah, so if anyone is concerned, obviously talk to your doctors about it, but go ahead and fill out the forms. It doesn't hurt to try. And I'll tell you what, a lot of times, I mean, I can't speak for all of these companies, but if you apply, they'll put you on their list and you may get earlier information than some other people, right? So
Yeah,
it's always good to get connected with those. And then, of course, stay connected with us here at Diann Shaddox Foundation and Essential Tremor
right.
Worldwide, and we'll get the hot off the presses information to you.
Okay, just to let you know, Diane, because you didn't mention it, and I don't know if it's part of one of the other studies. The one company that has allowed me to participate is Encora. ENCORA. I don't know if anyone's familiar with it, but you don't have to be there physically. So far, they're doing everything on Zoom before they send me anything, and they like measure my tremors on camera. So I just wanted you to be aware of that.
Interesting.
Yeah, that's great to
Okay,
know. Okay.
we will check into that.
Yes.
Thank you.
100%. Thank you for sharing. That's great. And I'm glad that you found something that you can participate in.
Yes.
Yeah, we'll be praying that works out. So there were a couple other questions, but I think probably the most relevant I'm going to pull out. There was a question about focused ultrasound, any long-term studies with that. So I did want to address that. Now, focused ultrasound has been approved as, so the difference between focused ultrasound and deep brain stimulation, just really quickly, focused ultrasound actually makes a tiny little lesion in the area of the thalamus. So it's permanent, okay, but it doesn't require surgery, okay? So you don't have to have anything cut on your head, whereas deep brain stimulation, it is called a neurostimulator, so it can be always removed later without having any damage to the brain, but it does require, an opening in your skull, small one, but to place a lead. So just a quick thing about those. DBS has been approved since 1987 for essential tremor. Focused ultrasound is really only about 10 years old. So the studies, probably the biggest study on focused ultrasound happened in 2019, which is now 5 years ago. And that was out of the New England Journal of Medicine. Now, I will say this is when focused ultrasound was only a one-sided procedure. Like you could not get the other side done if you had focused ultrasound. That wasn't even a choice. And they found approximately after 1 year, so that was their it was really short term, so it was up to 1 year, they found that most individuals had about a 50% reduction in their tremor. Okay, there was a very high initial side effect profile. The two main side effects that they found there were problems with gait or walking, and then problems with paresthesias or tingling that can sometimes be painful, sometimes not painful, but aggravating. And those were around 33%. So around a third of people got those initially. Most of them resolved. They wound up being at the year about, I think it was 8 and 9% still had some of those side effects after focused ultrasound, but still had about 50% tremor reduction. And then some of the other studies, there was a study in 2019 that compared DBS and focused ultrasound. And you can take a look at that as well. But that showed again that DBS was a little bit better at controlling tremor. So DBS generally gets about 80 to 90% of tremor, focused ultrasound 50 to 60%. And then the side effects with focused ultrasound were higher than with DBS. However, with DBS, there's a 1%, they say 1%, chance of having a hemorrhage, a bleeding in your brain with the procedure. That sounds very scary, and it is scary. But I will tell you, as a neurosurgeon, they have to include, even if there's 1 drop of blood in the head after surgery. And obviously we're not doing anything about that. That's not impacting anybody. So I would say clinically significant brain hemorrhages after DBS are very infrequent. Okay. And focused ultrasound, you're not going to have a risk of bleeding in the brain, right? Because there's nobody poking or prodding your brain. They're doing a lesion in your brain. So those are the studies right now, but there really aren't a lot of good quality, I'll say, longer term studies with focused ultrasound. I think we're going to see those coming in the next few years. So I did want to address that. And then I think we hit the highlights.
Okay. Well, I
Darlene?
want to, oh, yes.
I was just gonna say, the other thing is, it's only been maybe, what, 2-3 years that insurance started even covering any focused ultrasound.
Oh, that is something I would like to say. The military, if you're military, the insurance now, the government is covering focused ultrasound.
Right.
So yes, that's a good thing. All right, we're to
I'm
the
sorry,
end.
can I add real quick?
Oh, yes, go ahead.
My insurance covered all of my focused ultrasound. But okay, I was also going to suggest, if you're considering focused ultrasound, ask your neurosurgeon a lot of questions. They went through the whole procedure with me and found out my skull density was too thick and they couldn't even get to the spot.
Wow.
Yeah, extremely painful. So please make sure you get clarification from your neurosurgeon.
Thank you. That's a great thing to add. Okay, I want to say real quick that April is our official 10th anniversary of the Diann Shaddox Foundation for Essential Tremor. So this is our year's celebration, and I want you to be a part of it. If you would like to send us a congratulation message, video, please do that. And you can also join us for our special April the 27th ET Talks 10th anniversary celebration at 2 p.m. Eastern time. And I'm losing my voice. I want everybody to know we are doing our $10 challenge. Okay, guys, $10 challenge for this year. Think about how many people have essential tremor in the world. Please, if you can give a $10 challenge, we have made enormous progress in the world of essential tremor in the last 9 years. This is our 10th year. Let's hit it. Let's see what we can do for the next 10 years. Come on, help us. We need the funding to make a difference. Join us, go to www.diannshaddoxfoundation.org and donate $10. See what a difference we can do with $10 for everyone with essential tremor. We are going to bring awareness. We are going to bring ET. It's going to be out there as much as Parkinson's. Please help us. And thank you for joining. Please join us next month. Thank you.
Thank you, everyone. Have a wonderful, blessed day, and we'll see you guys.